My name is Sherry Latimer. I am the Executive Director for the Case Management Society of America, and I am the Project Coordinator for the National Transitions of Care Coalition. I'd like to take a few minutes to just share with you my thoughts and really my support around your Planetree affiliates program called the Care Partner Program. Prior to recording this for you, we've done a companion video which is available for patients and their family caregivers about the importance of the program and what a care partner can actually do in helping the individual who is dealing with their illness in better care coordination, understanding instructions, medication coordination and management, and in some cases hands-on clinical care. I think the thing that we deal with as professionals is how do we support the family caregiver and the patient in learning about their illness, how to self-manage that illness, and how to better coordinate the care. There is no doubt that in today's environment, we are still a very fragmented and siloed healthcare delivery system. Many of our patients who are medically complex are seeing 8 to 10 physicians, are having to take a significant amount of medications, and the coordination of all of those particular instances of transition from the primary care to the specialist, from the specialist to the hospital to skilled nursing facility, or hospital to home are very difficult. And patients don't know how to navigate this system. The implementation of the Care Partner Program allows us to work not only with the patient, but with a care partner who the patient has identified as someone they want to be there and assist them. Please watch the video we've done for the patient and family caregiver so that you know what we have been suggesting and really encouraging both the patient and family caregivers to participate in. Our role is how can we better educate them about their illness? How can we ensure that they are understanding the importance of having a medication list, coordinating that medication list each time a transition of care occurs, and understanding the importance of that care coordination of follow-up visits, discussions with various providers, the sharing of information, and the questions that they should ask as they are moving through the healthcare system. Depending on your Planetree affiliate and the program they have is also an understanding of what are the hands-on care that you are asking the care partner to participate in, and to ensure that that care partner feels confident that they are able to assist their loved one or their friend in the services that you need, whether that's a transfer from the bed to the restroom, whether that is providing meals for them, whether it actually is more intensive home care that we want them to be involved in. Giving instructions alone is not enough, either for the patient or for the care partner. You need to help them feel confident that they can achieve what you're asking them to do, coordinate the resources that you're asking them to do, and that they have an understanding within their own health literacy what is the terminology and the expectation of really working within the healthcare system and with the clinical team. It is also extremely important that the patient and family and caregiver understand that they are part of a clinical team. They are not sitting separate to that. The care that's being provided is for them, so how do we incorporate them in that? And how do they have the confidence to be able to do that? A lot of the interventions that we use as the professionals is to look at what may be hindering the patient or the family or the care partner from participating in working with their healthcare team, taking their medications, following up with follow-up care, or coordination of any of the information that they're getting from provider to provider. That's understanding where does the patient reside in this? What is their understanding? What are the things that they want to achieve? And that can only be accomplished by us not just giving them written information, hoping they understood what we said, and then following through, but by understanding what their health literacy is. What's their confidence in education knowledge or knowledgeable information about their illness, and how can we best support that? It may require a teach back. It may require us to demonstrate a procedure several times and have them do that while we're there, teach back to that, and follow up. It may involve, when they are actually transitioned to the next level of care, a follow-up call that is made to the home to ensure that they did understand and that they are able to do the things. And sometimes, all of us know, we have patients and we have caregivers who become resistant to some of the interventions, treatment options, and just follow through that's there. That's where we as professionals can implement what we call motivational interviewing. Understand why there are barriers to them being adherent to certain procedures. Asking open-ended questions to elicit good responses. It's very easy for patients when we ask a question, "Are you taking your medication?" for them just to say yes. It's a little bit more difficult to just say yes when you ask the question, "Can you tell me how you take your medication? What type of medication regime are you using at home to ensure that you're taking your medication on time and that you're taking them at the appropriate intervals?" I will encourage you as a professional not to just accept a closed-ended answer. Ask those open-ended questions. Investigate with your patients and care partners about what they're feeling, how confident they feel, and can they do the things that you're asking them to do in support of the Care Partner Program. I believe, both as a professional, as a caregiver for my mother who's 87 years old, the Care Partner Program offers a wonderful opportunity to not only encourage care partners to work with their loved one or their friend, but it offers them the opportunity to become involved with education, knowledge, and the confidence that they can actually follow through. We often send patients and their caregivers home thinking that we've done our job in helping them transition to that next level of care and that they are able to take the ball, if you will, and go with it from there. That is often not the case. Let's ensure that we can do that by building strong reliance and strong interventions in our Care Partner Program, and as the professional, ensuring that they understand what is needed and expected of them and that they can put that into place wherever they are in their next level of transition of care. Sometimes we ask, why is that important? Well, we know from studies that patients that come in for readmissions shortly after a transition from the hospital to home or to a skilled nursing facility are often related to misinformation, lack of information transfer, and lack of understanding. By implementing stronger support through the Care Partner Program, not only to the patient, but to the care partner, we help ensure that we can prevent preventable hospital readmissions. We can ensure better adherence to treatment and to medication regimes, and we enhance the quality of care that we provide to the patients that we serve and to their care partners in helping us as an extender of the clinical team in helping coordinate the system, understand the transition, and understand how to manage with confidence the self-management skills in helping their loved one through the disease process. I want to thank you for letting me spend a few minutes with you in sharing this information, and I hope that you will continue to support the Care Partner Program with passion and interest, because this offers such a great opportunity to our consumers to really be involved with us in the patient-centered care that we so believe in and make part of our mission and vision. Thank you.